Welcome to The Blend, a new bi-monthly podcast brought to you by the Journal of the Dermatology Nurse Practitioners and Physician Assistants. The Blend takes a deep dive into the expanding role of integrative dermatology, an approach to skin health that blends conventional medical dermatology with complementary therapies to address symptoms and underlying disease factors. In this inaugural episode, Dr. Sonal Choudhary, a dermatopathologist, dermatologist, and director of the Integrative Dermatology and Skincare Clinic at the University of Pittsburgh Medical Center, and Testa, a Dermatology Physician Assistant at the University of Pittsburgh Medical Center Dermatology, provide an introduction to integrative dermatology and discuss how it can improve patient care.
Hello, I would like to welcome all of our advanced practice providers, physician assistants, nurse practitioners, and physicians in dermatology, and any other specialties who want to learn more about integrative dermatology. We hope that we are able to provide some unique insight into what is up and coming in integrative dermatology, starting with our first episode today. I am Sonal Choudhary. I am a board-certified dermatologist and dermatopathologist and was most recently trained in integrative dermatology. I currently work at University of Pittsburgh Medical Center, and it is here that we have started a new integrative dermatology clinic. I get to work alongside a large team of physician assistants, medical students, and researchers, and my physician assistants are Hannah Testa, Jasmine Phillips, Natalie Gardinier, and Noelle Prevost, who will all participate in this podcast in different episodes. Joining me today is Hannah Testa, one of my star physician assistants who is really well versed in integrative dermatology. Hannah, I will give you the stage to introduce yourself now.
Hello, my name is Hannah Testa. I am a physician assistant currently working at the University of Pittsburgh Medical Center. My journey with integrative dermatology first started actually with my undergraduate education at Penn State University, where I studied nutritional sciences. It was during these 4 years that I was able to truly learn and fully realize the great impact that nutritional status had on an overall health state, whether that would be talking about cardiometabolic disease or dermatology. I was able to establish and further create a passion on how nutrition can play a critical role in skin disease. And so integrative dermatology allows me to combine my passion for dermatology and skin health with my passion for nutritional sciences and optimizing a patient's nutritional status. Dr. Choudhary, can you share a little bit more about your journey to integrative dermatology and how you first got started in the subject?
So, my journey started with my own problems and my own health issues, and not so long ago when I was not able to get good answers for my questions. And simultaneously, it also so happened that my patients were inquiring about questions that, while we had a lot of answers for them, was still not like I was finding people having frustrations with certain treatments, some difficult conditions, and things didn't seem as well rounded as they could be. And I'll say that, roadblocks that I faced really triggered me to learn more about areas of functional medicine that led me to see people who were trained in other areas in medicine than just our conventional, how we practice medicine or how I was trained in learning medicine at medical school. And the dissatisfaction from me and the patients together was the leading factor for me to look more into what else is out there. And I have to say, I grew up in India, and I had this background growing up, a lot of which was related to Ayurveda, home remedies. My mom or my relatives and family members and friends, they often would resort to using a lot of home remedies, etc., that would help them in their disease states. And because I was going to medical school, I was a little more feisty about not listening to some of those things. I was more of, we need to go by evidence and we have to always see what science has to say, which, absolutely, I still believe that. But there was science behind a lot of these older, ancient scientific methods, which were not fully uncovered for me as a physician to utilize for my patients. And even to this day, when people come in, they often have things that they have experienced, they have tried. And again, the idea is to blend it together, to not have to talk about medications all day long. And I was helped a lot by this through my training with Learn Skin, where I did a fellowship recently, and that became such an integral part of my practice. I'm also a teaching faculty on and off with them, which empowers me as a provider. And there's a lot more I can share with my patients here on.
So, in our first episode today, we're really using this first episode to introduce the idea of what integrative dermatology is. And this leads me to a rather simple but important question, and that's Dr. Choudhary, why are we having this conversation today? Why are we gearing a podcast toward this subject in integrative dermatology? How does this differ than the conventional dermatology we know so well?
So, Hannah, this is very important. This is a topic that is close to me, but that's not the important part. It's important to the patients. They need it, they want it. This approach is a sustainable approach because it takes care of a lifestyle for the patient. We have so many patients who, feel like there's a standstill they have reached with their treatment goals. They are frustrated. They have a limited tool set. And I'll tell you this, we are still doing this study, it's still continuing, but we have data that we analyzed from our own center at UPMC and actually recently got, accepted for a poster as well that showed that we analyzed these 205 completed surveys from our patients who we asked, what do you think integrative dermatology means to you? If you were to see an integrative provider, what would that look like? And in this questionnaires, about, like I said, 205 patients answered it. And when we analyzed the data, it showed about 65% of the patients would visit an integrative dermatologist, and about 60% of them would see us for acne. About another 60% would see us for atopic dermatitis or eczema. Skin cancers even was high on the list of 50%. And about 75% of the patients wished that dermatologists discuss the impact of lifestyle factors on skin, diet, sleep, exercise, and stress. And, this really goes to say that when we are seeing a patient and we are only focusing on that one problem, it is not the whole problem. And the patients leave very dissatisfied. And most of these diseases, there is likely not a cure. And we have very good medications out there. There's all these trials available to us, and ongoing and new drugs coming out. But it is not again, like I said earlier, not the end all be all, because what happens when you come off of a drug? What will the disease state that, say there's a metabolic disease state connected to, for example, psoriasis, if we are not looking at those other factors, how long are we going to expect a drug to take care of a patient's disease? Everything has side effects, everything has long-term effects. So that is where a lot of the patients have raised this ongoing need to equip them with other ideas, tools, science-based research that can come through supplements, that can come through traditional medicine. It comes through clinical and preclinical models. I share sometimes examples that are not from human studies, but it still resonates with the patient in their understanding of their own disease state. And the point of this integrative dermatology is that we want to have personalized precision medicine.
Absolutely, Dr. Chaudhary. I agree with everything you were saying. And at the core of integrative dermatology, the word patient centered really comes to mind. Because when a patient walks through our door, we know that they are an individual that's coming with incredibly unique needs, concerns, signs, symptoms. And integrative dermatology really focuses on the patient as a whole. And not only that, but it also delves into the root cause of the condition. This provides a patient with a great enhanced sense of control because identifying the root cause of a condition truly allows a patient to grasp a deeper understanding of their condition. And this can be super empowering.
I agree. The heart of integrative dermatology and integrative medicine is to provide tools. We also look at things like environmental factors. We talk about stressors, nutrition, et cetera, and their social support. And that just makes me want to ask you, when you are seeing a patient, we will be sharing a lot about how we see our patients in this integrative clinic and what are the things we start looking into besides just that disease state. What are your, say, number one and number two things that you always try to talk about in the first few appointments?
Yeah, absolutely. So in an appointment, one common question that I really like to bring up very early on is assessing and getting good idea of a patient's certain stress level. So not only do I want to know what their average stress level is, but I also like to ask the question is if they've experienced any recent particularly stressful events. And more often than not, everyone has stress in their lives and they're able to recall a specific event or stressor that's occurred in their life. And interestingly, very commonly, the timeline of a patient's particular stressful event really correlates with the timeline of, for example, a flare of their skin condition that they're presenting with, whether that be atopic dermatitis, alopecia areata, hidradenitis. When patients are able to, not only share the recent stress, but also come to the realization themselves that this stress coincided with the flare of their skin condition, this can be very motivating to patients that first of all, they're able to realize that skin can be related to stress. And second of all, they're able to see the immense detrimental impacts that stress can play on both physical and mental well being.
And before you go to your second one, Hannah, I want to like jump in and add that, we all have stress. And the moment I would use the word stress to the patient, they have all kinds of expressions for me. Sometimes they are delighted to hear that I'm bringing it up. Sometimes I get an eye roll. But at the end of the day, everybody has stress. Nobody ever says, I have no stress. I am very happy. I don't want you to talk about this. Some people don't want to still talk about it, but the fact that when we bring it up, it is the elephant in the room, and it it really makes them understand that it is a cause. It is an underlying issue. I'll give you an example of like biofeedback, right? So when somebody has an ongoing, it's part of several kinds of therapies where biofeedback is used. By just monitoring a patient's heart rate response or blood pressure response, we're showing the patient, see, this particular event is giving this biological effect to you. And then they're able to calm themselves down with other techniques and control that heart rate and blood pressure. So if we are capable of doing that, bringing the conversation about stress and acknowledging that it's there is the starting point for majority of the patients that we see, as like, hey, this is where we want to start working. We cannot ignore this. Drugs are not alone going to fix it. So I think that that's all I want to add there, because this is a regular topic of conversation in the clinics, whether sometimes we don't get the best response.
Another discussion point that I like to bring up in integrative dermatology appointments is getting a very good understanding of a patient's dietary habits. So I'll bring up this conversation asking super simple questions such as, all right, walk me through your breakfast plate, your typical lunch plate, what's on your dinner plate? Are there certain new foods that you've tried recently? What is commonly in your fridge? And from there, I kind of further the conversation and tailor it based on the specific skin disease, illness that they present with. So, for example, something that comes quickly to mind is acne. So, say, for example, a patient's walking me through their typical breakfast, maybe that's sugary cereal, and we move on to lunch. I'm noticing that their lunch and their dinner is full of dairy products. Well, this provides me a great opportunity to provide resources and science based tools to patients to tailor their dietary habits to best suit their treatment goals and further optimize maybe some conventional treatments that we've trialed. Maybe that's topical or oral antibiotics that are used to treat acne. What a dietary intervention can do is optimize and further help with breakout control for these patients. We'll even talk about how we can provide certain evidence based tools and resources to patients when we're discussing specific nutritional interventions related to skin disease.
100%, Hannah. I mean, high fat and high sugar diets are so closely related to acne. And again, just telling them to stop eating all those things that they're so used to eating can just lead to non-compliance. So giving them resources and giving them tailored programs can be very helpful. Most of the people do pretty well with that. There is always that, there's always a few people who might find that also to be difficult or struggle with it. But hey, that's what this next appointment is for. And I'll tell you that in my appointments, I get asked a lot about gut health or gut skin axis. And if I don't bring that up with my patients, usually this is a topic that I either bring up in the second half of the first appointment or the second appointment. But if it is not brought up by me, it is sometimes brought up by the patient. And they will ask, I've been suffering from interesting GI symptoms lately, or I've always had something like an irritable bowel symptoms, or I seem to have diarrhea very often. Anything that is related to the GI system can be associated with the skin findings. And it's not always a one-on-one, but we have ways to look into gut microbiome now. There are gut testing kits. There are gut that patients can sometimes do at their own home. But in our clinic, we provide those services. Now, there are so many gut testing kits out there, and maybe in one of our future episodes, we're going to discuss how we maneuver, how we navigate through those questions, and how we go about these testings. There's a lot out there, but at the end of the day, we're trying to get an assessment of the gut microbiome and how can we help this gut to heal so your skin can suffer less. So that really is what I try to ask in my first or second appointments, I'll say.
So, Dr. Chaudhary, how do we really navigate the different tools that are available in conventional dermatology versus integrative dermatology?
Yeah, I know. I mean, I think you did kind of bring this up earlier. And conventional dermatology is what? It is us doing our training, our going through medical school. We do dermatology training as residents. Some people do fellowships, and that really gives us this wholesome knowledge of medications, topical, systemic medications, biologics, the research that we have to kind of keep up with evidence-based tools, and we provide that to the patients as the disease requires it, right? Now, integrative dermatology differs because we have increased diversity of options that we can offer our patients now. It can look like a conventional appointment, like in our integrative appointment, we don't hold back conventional therapies. We talk about them, but we also try to fill those gaps and holes with other missing pieces, as we kind of highlighted a little bit of them a second ago. We have to make their treatment well-rounded. Otherwise, we're centering them around a single drug. And guess what? Drugs fail. Drugs fail all the time. We have non-responders to no matter how many different drugs. Hidradenitis is a very good example of that. We are constantly running into the new medications slowly coming out in that disease state, but we are still encountering people who have absolutely no impact on their disease from these medications. Of course, we still need more research, we need more data, we need more understanding of pathogenesis, but we can definitely utilize tools from outside, from lifestyle factors. Drug optimization is kind of my goal with my patients. So if I have a hidradenitis patient on Humira, I'm not going to just stop there. I am going to look into lifestyle factors. I will tell them, I'll just ask them, do you think you want to be on this drug for the rest of your life? Is there more we can do to maximize, optimize other, or enhance your safety net so that we can try to get off of this drug once your disease has reached its remission phase? And I always get the answer, absolutely yes. So that's where we utilize a lot of our tools in order to help these patients have a more well-rounded care. Now, I think, Hannah, I want to ask you, can you tell me about one of your clinic encounters? Like when you have a patient say, pick any condition you like, and what does that look at your end? I chose hidradenitis, but maybe something else, and tell us, what do you do differently when it's an integrative appointment?
Yeah, so let's say we have an eczema patient that walks through the door and they are coming to the clinic having tried and failed a couple different topical options. They're currently flaring, they have eczema on their skin, and they're looking for further treatment recommendations to calm down their itch, calm down their suffering. And at this point in your treatment algorithm, you're considering if a patient possibly needs, further treatment with a systemic agent, whether that be corticosteroids, whether that be immunosuppressants, phototherapy, biologics. And you might get to the physical exam portion of your visit and you notice that their skin is particularly xerotic. And one simple integrative dermatology related treatment recommendation that you could think about is a supplement called L-histidine. Now, L-histidine is actually an amino acid type supplement, very affordable, accessible over the counter. And L-histidine has been shown to optimize the functioning of filaggrin and boost natural moisturization factor on the skin. And in doing so, can help boost and repair our skin barrier. Now, interestingly, a 2017 study looking at patients diagnosed with atopic dermatitis taking L-histidine daily at a dosage of 4 milligrams found that actually, after 4 weeks only, atopic disease severity reduced by 34% by utilizing a physician assessment tool called SCORAD, which basically stands for Scoring Atopic Dermatitis. This is an eczema severity scoring tool that physicians use. And then with a patient self-assessment, eczema severity score is reduced by 34% in just 4 weeks. And so what L-histidine can do, and what we've seen in clinic, is that it can help to, for example, reduce the usage of topical steroids for a patient, or even stave away the need for consideration of systemic treatment by introducing this super, very accessible, affordable supplement into their regimen. So that's exactly what we're trying to do. We're trying to optimize the treatments that they've already tried. And in that sense, we're able to give them an affordable and attainable option that they could take long term.
Yeah, I can't tell you, Hannah, how many times I have told patients to try L-histidine. And once I tell them how inexpensive it is, I always get a smile on their face because they're often trying to resist another thing in their regimen, but this one they often will take too easily. And in that study that you mentioned, actually, you said 34% in 4 weeks were actually already seeing improvement in the severity. The patients themselves also saw in their own reported assessments about 39% improvement. So it was just a simple addition. And of course, in a study, we try to see things uniquely and separately without having influence from other medications. So this is actually very good outcomes. And I think that such tools we need to keep combining and optimizing, and hopefully, the more we do them, they become more affordable for the patients as we go on.
Absolutely. We have so many evidence-based tools in integrative dermatology, Dr. Chaudhary. We continue to use them and research them further. And at the end of the day, one of the biggest goals of this podcast is just going to be sharing our experiences, our skills, our knowledge, all of which are growing every single day, with clinical practice and new science that's coming out in the integrative dermatology realm. And so, if anyone has any questions about this podcast specifically, or are curious about questions they'd like us to answer in future episodes, you can email the address that I'm going to list right now, and that's asktheeditor@jdnppa.com. Again, that will be asktheeditor@jdnppa.com.
Thank you, Hannah. And, I agree 100% with you. We want to hear your comments. We want to hear your questions. We're going to build this podcast around some of those things that you will ask us. And our goal is to treat the whole person, not just a skin disorder. When we find a root cause, we can try to treat it. And in our exploration of the root cause, we will end up empowering our patients, understanding the disease process better. So either way, it is a win. And what I last want to emphasize to our listeners that moving forward with every episode, hopefully we can bring you more such examples, experiences, and data, and we welcome your feedback. We'll see you soon. Thank you for listening.
We hope you enjoyed this episode of The Blend. We'll see you back next time.